You're listening to the Joy Tax Podcast, a conversation series for parents and caregivers raising a child or teen with complex chronic conditions. The normal parenting wisdom doesn't fit the situations we are living through. This is a forum to share, affirm, and learn from each other. It's also a window for allies to listen in and gain deeper insight into the world we inhabit. This podcast is not a substitute for medical guidance. We encourage you to always talk to your healthcare provider before making any medical decisions. Hi, I'm Mercedes, and this is the Joy Tax Podcast, named for the symptom post-exertional malaise. I'm here today with my former physical therapist, Sallie Rediske. When I was in my early 20s, I had an accident, a minor accident. Actually, I was just picking up a piece of furniture, but it led to a handful of years of some intense pain and mobility issues. And when I first met Sallie, I was shuffling across the room. And I credit Sallie with my ability to be able to live a full and active life, which is why I was surprised in 2016 when she had to shut down her practice. I didn't know that the entire time she had been treating me, she had ME-CFS. When I asked her how I should introduce her, she said, "I have never figured it out thanks to ME. It has completely messed up my ability to tell a simple, straight synopsis of myself without sounding like I am confused, lying, or was never sick." Sallie is one of my heroes. I've invited Sallie to talk with us today about her experience growing up with ME-CFS, as well as lifestyle management strategies like pacing for post-exertional malaise. Thank you so much for being here. Can you start by telling us what it was like to grow up with ME? Did they call it that then?
Oh, they didn't call it anything. Yeah, so I trace the roots back to 1976. So that's when my life turned upside down, but we didn't know what it was, and we certainly didn't have a label for it. It was a really bad period of just a long, decades long plus period of just being disbelieved, being gaslit, being told that it was a character flaw, that I was, overweight, that I was lazy, that I had, school resistance and school phobia, that my parents were bad parents. That was one of the hardest things, was to witness my mother being scolded repeatedly by the male doctors. I was treated for 15 years as a psychiatric patient, and none of those treatments worked. That was the thing. I want to make clear that there's nothing wrong with, if you have a psychiatric diagnosis. I'm not belittling or minimizing those diagnoses. It's that I repeatedly demonstrated that that was not what I had, and yet they continued to treat me that way. And that was the hard part. It wasn't that, I was successfully diagnosed with something that actually helped. And so it was, there was a lot of fear, and I did a lot of hiding of symptoms because the symptoms were so bizarre from anything that I knew of, that I was absolutely convinced that if anybody knew of some of the symptoms, that they would take me away from my parents. And in the years since, I've had educated clinicians that were practicing in the 70s that said that that was probably an accurate assessment of what would have happened.
I don't know if it was you or someone around the same time said to me, when my daughter's symptoms were accelerating, that she was probably experiencing symptoms that she didn't even know were symptoms that had become so normal for her. And I also, flash forward, this is 2023, I was also careful about what I shared with doctors and what I didn't share with doctors, in part because I didn't know it was interconnected, right? I didn't think to tell our doctor, for example, she's not sleeping at night. But it's really surprising to me that you're talking the 1970s and now we're in the mid 2020s, and in many ways things haven't changed. Can you tell me? Do you know what the inciting event was that triggered ME in you?
Yeah, so this did not, I think probably by the time I was in my late teens, early 20s, we had, with my psychiatry orientation of looking at this, we knew that something had happened to me between the summer of second grade and third grade, but we couldn't figure out what, because that's when my whole life turned upside down. And, it was looked at as, some kind of psychological trauma. And, nobody could figure out what that was. And it was only, it was quite a ways into the 2000s, actually, when my mother, who has since passed, thank God she was able to help me reconstruct this before she died, we realized that in the summer of 1976, we know exactly the day even now. In August, we as a family took a backpacking trip up Mount Washington in New Hampshire, and I followed my 7 years older brother up the mountain chasing him. My parents were walking behind us, and Mount Washington is notorious for its very dangerous weather. Even in the summertime, they have trail monitors along the way to make sure people don't get dangerous effects of the weather. And as he went on up the mountain, and I never caught him. And I was 8, and as I got hot and sweaty, and as I came out of the tree line, a group of trail monitors found me, and I was already hypothermic. And they bundled me up, sat me by the fire, and I remember the fond piece I remember, it was the college students, and they gave me hot cocoa, and I thought it was the coolest thing ever, And the part that was really stuck in my mind, and that Mom and Dad remember, was the night after that was them wrapping me in cold, wet towels to bring down a really high fever. And then looking into this later, pediatric case coming out of hypothermia too fast can bring on a rebound fever, and we think that's what it was. And by the time I started school, several weeks later, I was already having trouble. And from then on, I missed considerably more than the state would allow for each year of school. Nobody ever said anything because I always kept my grades up. I was always a good participant in school, but I went from having perfect attendance in first and second grade to missing all of, way beyond after that, and just having, endless infection, living every week till the weekend to try to make up for it. Every holiday was spent trying to recover. Every summer was spent trying to recover. And it just went on like that.
Your story reminds me so much of my daughter's, and one of my bigger regrets is that I didn't reach out to you sooner, especially this piece about frequent illnesses, because when I look back, there wasn't, some people who get long COVID, they have COVID and then they never recover. My daughter had COVID, and I don't know if that's what triggered her autonomic nervous system dysfunction and neuroimmune issues. But all of a sudden, she also was not able to go to school nearly enough by anyone's standards. And I kept thinking, oh, it's going to get better. It's going to get better when we get around the next corner. What did your parents do to make you feel supported during that time? Or I guess I'm making an assumption. Did your parents make you feel supported while you were going through this?
I think there's a couple of parts to this. One, it was a different generation. My parents were old parents as it was. I was an oops baby, so I was like a second child, a second family almost, like an only child. And so they were very they were they didn't seem to worry too much, but they never ever questioned my complaints or anything that I presented to them. It's the fact that I withheld so much. And then because of the generation, I think, especially, I mean, even in the 70s, but then their age, I think, left them in a bad position where the doctors were totally the definitive answer, to everything. And they really didn't push back on anything. And, my mother at the end of her life discussed a lot of anger and resentment towards the doctors, but she never stood up to them, when in the midst of it. But they never made me go to school when I couldn't. They never ever pushed me. So from that standpoint, I was remarkably lucky.
That's huge. I see so many parents who desperately want to get their kids back to school. And I mean, I feel that. And my daughter's able to go to school 3 mornings a week this semester. And that feels revolutionary. And it also feels like, you always want more for your kiddo. And yet, I think this is leading us into pacing for PIM. Because you said to me recently in a conversation that it was probably good that we were just doing the mornings because she still gets to live the rest of her life, right? It's not just going to school and then spending the rest of her time recovering. She's going to school and hanging out with grandma and, doing cooking projects. And so she gets to have a kind of wraparound life. Can you start by telling us what post-exertional malaise is?
Yeah, so it's really important that this, people with these illnesses and then the people who love them understand and are adamant that medical providers understand this, because they do not know what it is. I will tell you that 9 out of 10 providers, at least that many, do not know what it means. So what they think it means is post-exertional fatigue. And that is not it. Post-exertional malaise is the exacerbation of any of the myriad of symptoms that can present with ME-CFS due to any type of energy exertion. So that can be cognitive, physical, emotional, orthostatic, which means getting up and down in gravity, or sensory. And so it can, some people have, let's say, a list of 100 symptoms, and another people have a different list of 120 symptoms. And it can be any of those things. And so the most common does include fatigue. It does include pain. It does include swollen glands, headaches, GI dysfunction, but it is not fatigue. And people need to understand that and to apply that simplistic idea that it is post-exertional fatigue is so minimizing to the people who live this illness.
I was going to ask you, why is that distinction important? But can you talk a little bit more about that? Why is that important?
Yeah, because when you have a normally functioning metabolic system, so a normally functioning energy producing system, the normal way to fix an energy deficit or tiredness is actually to exercise it, is actually to gently push it and nudge it along and to stretch it a little bit, to push the boundaries of it and to increase its capacity by doing that. But when you have a broken metabolic system, which is what causes PIM in ME-CFS and long COVID, then you actually, if you were to do that kind of method of treating, then you actually damage the person. And so you can't, if you're thinking of it as just what would be labeled chronic fatigue, as in, oh, I'm tired, then the two are not the same thing. Fatigue that falls under PEM is because the metabolic system is broken and the treatment is pacing.
One of the things that I see come up on parent boards pretty frequently is this PEM or is my child sick? Is this PEM or does my child now have joint issues? How can parents recognize PEM in their child?
Yeah. The best thing that I can tell you is that the people that I know who've witnessed their children go through this, the common refrain is, I wish I had just acted as if it was PEM and waited for the response and found out if it was or if it wasn't, because if it wasn't, it's easy to return to normal life. If it is PEM, the damage that you prevent can be enormous. And so, because PEM is often delayed, I mean, sometimes there are some immediate signs of PEM that people can get. It's like little flickers of symptoms. And then usually what you'll see is there'll be little flickers of symptoms, and then there'll be this kind of lull. And then 24 to 72 hours, that's when the real punch comes, where the person's really knocked down. So parents can do things like look for those little flickers, look for the changing and breathing, look for, the child saying that, they're beginning to get a headache, or their eyes are tired, or their limbs feel like they're getting heavy. Those are not things that happen with normal kids. First of all, if a kid gets really tired from playing, they're just going to go grab a book and read for a little while. They're not going to go, gee, Mom, my legs got really tired out on the playground. They're just going to go do something else and then go run back out and do it again, And so that's the first thing. And then the other thing is, if you do back off and let them rest, and their symptoms are moderated, you start to see, oh my gosh, they're actually sleeping better. Their tummy's not hurting as much. They're not complaining about headaches. Their mood might be more stable. And then you decide you're going to keep them on a pattern like that. There you go. There's PEM. Or in the rare case that it is not PEM, you do this, and after, a month, 2 months of doing this, you realize this is definitely not PEM. This kid's fighting me. They're not any better. They're not any worse. It's just not working. Let them go back to their normal life and see what happens. Do their symptoms get any worse again? No. Okay, they probably don't have PEM. And your child's not going to be worse for that delay. They're going to rebound.
One of the things that has always struck me with my kiddo is that when she can do, she does. And
Absolutely.
sometimes, and sometimes in a scary way. And sometimes I worry, we all worry about so many things, but she actually just had a minor PEM episode. We had a very busy weekend with a family dinner. I let her have a sleepover for the first time in 2 years because we're very careful about managing sleep. And then there was a trip to a doctor's office far away. So, more disruption of routine. And we got back on Monday night, and then Tuesday, she woke up and you could tell that there was no school, right? And then Wednesday, no school. But then she woke up on Thursday and she had a smile on her face and she said, I'm ready. And for me, that seems like it's so much different than the crashes that she had a couple years ago. And I hope those are at bay. I think we all do. But whenever, even when it's mild, I still have moments where I wonder, is this PEM? Is this a new normal? And then she teaches me every single time that when she is able she does. And luckily, we have had a supportive school environment that has supported us and doesn't shame her for missing school, and that has been really, really wonderful. I think one of the other challenges as parents is that we are our kids' governors, right? We're the ones who drive them to school, who tell them what's important. An adult can say, I need to stop. A child is looking to us for affirmation that it's okay.
Yep. And the difference of there's a really good paper that was out probably, I don't know, 12 years ago. It was written by Eleanor Stein, and it outlined the difference between mental health, like depression, relative to ME-CFS. And it was such a helpful paper because it was so clear about the difference between the two. And when you see it written out side by side, it is so literally black and white in the paper, of how different it is. And I still do to some degree, with my own PEM, I'm always amazed at, like in the depths of my PEM, I just feel like, oh my God, brushing my teeth is just like, I can't even do it. I can't even think of how to get to the bathroom to do this, and then, 4 or 5 days later, sometimes, it's just like, oh, brush my teeth, floss my teeth. Oh, I'd like to see if I could maybe even use the styling brush on my hair. It's like a whole new world when I feel better. And when kids don't make this stuff up, there's no way. They don't have a reservoir of experiences to come up with this stuff. It just does not exist in their brains to be able to do that. It doesn't even exist in the adult brain to be able to do that.
There's a study that I read. It wasn't a study. It was, I think, just an doctor's notes, and it was maybe circa 1920, and he was describing the difference of his patients between those who had what they then called neurasthenia and those that he considered had depression. And he said the biggest difference is that those with neurasthenia want to do, but whenever they try to do, then they wind up in bed with these symptoms that that seem ridiculous. And I found this article when I was trying to research, well, how do people raise kids with this? Because obviously this generation of kids is not the first generation to have these kinds of autonomic nervous system dysfunction symptoms. And it's not just long COVID. It's existed for a long time. I'm kind of veering right now. Why do you think it's taken so long for doctors to recognize the complexities of what we experience?
I think that one of the biggest problems was things got derailed in the handling of the original. It wasn't the original cluster, but the Lake Tahoe cluster back in the 80s. And then what really got things off track for ME-CFS patients, and it continues to be problematic, is the fallout from the PACE trial that was in the early 2010s. And the consequences there, it takes, the studies show that it takes 10 years for something to get from research into clinical practice. I would argue that it's actually, I don't see it moving that fast, and especially into small communities, it doesn't move that fast. And so what happened in that study was it was a horribly done study, and it should be, in fact, one of the authors of the paper that I wrote with the other 3 authors, he teaches it as a study of bad research in the PT department. And so what happened there is, unless you take the time to read it and to understand the bad research, and you understand the history around it, you're going to kind of just absorb it. They've never retracted it from the very highly thought of publication that it exists in. And then what it did was it went into what's called the Cochrane Review. And the Cochrane Review takes all of the literature on a particular topic and summarizes it so that clinicians can look at one of Cochrane's papers and quickly make an assessment based on all of the analysis of all the papers that they've looked at. Well, because the PACE trial was the biggest study ever done up until that point, it weighs really, really heavy in the research. And because it's never been retracted, it's still in the Cochrane database. And then Cochrane this last year they for 3 years were working on updating it. They had a whole team to do it, and they decided not to update it against the advice of the team that was looking at it. The directors of the group that was looking at it just decided they were done with it and left it as is. So the data is still wrong, and so it's still waiting the review. So clinicians are still looking at the same garbage, and it's heavily weighted psychiatric.
That's what I was going to follow up on. For those who aren't familiar with the PACE trial, correct me if I'm wrong, but it was heavily weighted psychiatric. It encourages cognitive behavioral therapy and graded exercise. Is that correct? Those were the three main things that it. What's the difference between graded exercise therapy and true pacing, not as what that paper talked about?
Yeah. So graded exercise therapy is the idea that there is a preset advancement in duration, frequency, and intensity. So duration would be how long you do an exercise. Frequency would be how often you do it, and intensity would be for how hard you do it. And so each one of those domains, you would have a preset amount that you would increase. And those amounts are preset either by the patient or by a clinician, usually by a clinician, if, obviously if you're working with one. And there's this fake or false idea that if you only increase in one of those, of the three domains, that is not grading. Do not let anybody fool you. It is still graded exercise. They will try to pull that on you. It is also being called progressive exercise or progressive activity. That is graded exercise because an exercise is an activity. It is just a formal kind of activity. So if anybody tries to put that on you, tell them to stop it. So pacing is the idea that you're truly basing it on the patient's symptoms in that moment, in all of the sensory domains that they have. So, how they are feeling in their respiration, how they feel orthostatically, how their head feels, and how they are going to feel later. So you've got to be able to, you assess their momentary feeling, and then you've got to wait long enough, at least 72 hours at least, to reassess, because PEM can happen at least 72 hours. For some people, it's even more delayed. So you've got to actually be able to wait it out and see, how did that session of what we did impact this person before we do anything else, because it may have been too much.
How do you, what are some measurements that you can take in turn? Like, should people monitor their heart rates while they're doing activities? What are some other ways for pacing?
So I'm a huge fan of heart rate pacing because, one, that's what's helped me the most, but heart rate pacing is objective. It means, that you get an actual number that relates to something. And so it's giving you a real indicator of where the body is going awry. Okay, so it's not just an arbitrary number. It's telling you what is happening internally. The problem is that heart rate pacing does not pick up on cognitive effort. It may not pick up on sensory effort. In my case, it does. Mine picks up on emotional effort because I'm kind of off the rails emotionally sometimes, so it does pick up on my emotions sometimes. But so you have to build in some other ways to identify what your pacing is doing. You can't always just rely on the heart rate monitor because you'll not capture everything. So there's one of my very favorite tools out there is from Workwell Foundation, and it's called the PEM Time Course handout. And they break it down into 3 categories: immediate, short-term, and long-term PEM. And you never want to get into the short-term and the long-term. You always want to capture, identify your symptoms in that immediate range. And one of the best things about that handout is it helps you recognize, like, oh my God, I didn't even realize that was an early warning sign of PEM. I had no idea. I just thought that was a little quirky thing that my body did, like it just doesn't sometimes even register, that's tied to the later, really full-blown PEM. And so then it can also help you, maybe develop an awareness of your own personal sensory feelings that you may have that aren't even on that list, that and like for me, I have very distinctly different presentation for cognitive immediate PEM than I do for physical PEM. So it's really important for me to know what those are and to pay attention. Another tool is called the rate of perceived exertion. And the idea is, there's 2 different scales, but the one I like is 1 to 10. And it has a nice color scale, which to me is really helpful. Like green is good and, flaming red is not good. And so you want to stay down there. Everything should be very, very light effort. And when you get into a place where your breathing starts to change, you're doing too much. It's that. And so learning what that scale means and to kind of internalize that can be a really helpful tool also.
You passed these tools on to us when Evelyn was still quite young. She was 9 when this first started, and some of them were a little tricky to implement because she was so young, and there's so much interpretation. And yet, through paying attention to through symptom management and the charts, I was able to recognize, for example, that when she was experiencing auditory sensory issues, that was one clue that if we didn't slow things down, that we were going to, have some payback. So I found it to be immensely useful, and also as a reminder as a parent, because we're not if I don't have an energy limiting condition, and so I am often interpreting how my daughter is presenting and how she is saying she feels. What are some other ways that parents could help their child pace? How would you recommend a parent apply these pacing strategies for their children and teens?
Well, I think it's really important to think about, like, the name Joy Tax. And joy has to be first and foremost, because life is just turned upside down for people with these illnesses, and that needs to be prioritized. And then secondly, people need to focus on, in the therapy world, what we would call ADLs and IEDLs. So ADLs meaning, your basic requirements of life, like toileting, eating, and dressing. And when those needs are met, then you can start to begin to add in other things. Like I said, but to me, especially for a child, the joy comes first, even before that. And so, like letting the kids stay in their pajamas all the time, if that's what they got to do, but they still get joy, you do it. and your parents really need to let go of a lot of strongly held convictions or conventions about things. And that old saying about being a parent, that you just pick your battles and don't sweat the small stuff. ME will make you not sweat the small stuff so bigly. I mean, it will just, it's like, and so those are the first two things I think you have to just get through your head. And then the next thing is to do exactly what you just said, is to learn these documents that I brought up and mentioned for yourself, like in the sense of observing your child and listening to your child's language, because your child may not have the language and may not use those words that are on the paper, but they're going to use words that if you listen well enough and you watch them, you're going to start recognizing those words as, oh, that's what that means on that paper. And you're going to be able to help them and say stuff like, they want to go outside and play, but you've noticed that they're sighing a lot. That's maybe an example, that they're just, around the living room and they're doing that. Well, that's a breath change. They're doing something, trying to get some more breath. Why don't, and a way a parent could say is, why don't we snuggle up and watch a movie? Let's do a movie afternoon. I'll make some popcorn. Let's do a movie afternoon. And, introduce some things that are down regulating, that don't involve activity as physical or something. Trying to, let's maybe the bedroom's upstairs. How about let's make a pallet on the floor this week? Down here, I'll sleep on the floor with you this week. How about that? Maybe we can I'll make a fort and we can sleep on the floor down here this week and avoid going up and down the steps. Maybe we can play a game and see how many times we can avoid going up the steps this week. The examples that I just gave are obviously for people who are more like your daughter, but for people who are very much more involved, how do you bathe? How do you change clothes? How do you feed? And this is the realm of an experienced and trained OT. And I can give you a link for a good resource there. Bateman Horn Center has some great tools for that type of situation.
Bateman Horn has just been an invaluable resource. As you were talking, I was remembering that behind me, my bed, we used to call it the raft when my daughter couldn't get out of bed for months at it. Well, she could get up and go to the bathroom, but the movement was very limited. Day-to-day life was very limited. So on the weekends, I work full time. I would make it the raft and just try to make it extra fun. I would bring her art projects on a tray so that she could watercolor. One friend did something, and it still makes me tear up to think about it. A friend realized how limited my daughter's life was, and that cognitive things like writing a letter was challenging. And so she had her son, who's the same age, start a Lego pen pal club. And so he would make a Lego thing and I would bring it home. And I remember one day that when I gave it to her, she teared up because she hadn't seen kids in a really long time. And here was this kid reaching out to her. And then her job was, on whatever her time schedule was, and it was a free form Lego thing, was to add more Legos to it.
That's
and then
awesome.
Send it back. And then that kid would do the same thing. And then at the end of the winter, school was winding down. My daughter was well enough, and they met up in person for an ice cream play date. And I mean, there's so much to be taken from that. One, pacing, but also how other people can, because this is really isolating for kids. And it just meant that mother and child reaching out in that way just meant so much. And it brought joy without inducing that tax element.
Yeah.
One thing that I'm always concerned about, I try to measure it in myself, like that, this anxiety of what's going to happen. I'm thrilled for 3 mornings a week, but middle school's coming up and high school, and you can get yourself spinning. And I just try to stay in the present. But a lot of parents, especially I notice as their kids are getting older, freshmen, sophomores, late middle school, they have a lot of anxiety about their child's inconsistent school attendance and what that will mean, and their child's or teen's inability to do all the enriching activities that we envision high school life to have. What would you say to those parents that have that kind of anxiety?
I think that our culture's gotten a little top heavy with that stuff, to be personally straight about it. And I feel like that there's a lot of stuff that I've learned from ME, which I've always said, the stuff that I'd learned, I promise I would have just read in a book and really absorbed it. I did not need to live this to learn it, but that is one of the things I think that that we very often put a lot of weight on things that probably really are pretty superficial. And so that's one of them that I think that has probably just gotten a little bit out of balance. And so one, take a breath and realize your kid's going to be the bottom line is looking at your child from the perspective of, is your child believed and supported at home, and are they getting the best care and the best emotional support from their healthcare provider? I've said publicly fairly recently that my ME was not avoidable, but the trauma that I carry, that I deal with every single day, every single moment of every single day, was 100% avoidable. And so I think that's where people should be paying attention and should be really focusing. And I think that comes from good parents that pay attention to their children and validate their children, and find providers who validate their children, even if they can't cure them. And then the other stuff is more icing on the cake. And you just find some nice, meaningful ways without being overloaded. I don't think, maybe I'm naive about this, but to be honest, I went to a really, really high performing high school, and I had some girlfriends come up last year from back there, and we were looking at old yearbooks, and we were flipping through, and we're like, it's really weird, because as competitive and as high pressure as school was, nobody really, there's not really anybody standing out doing all that big stuff. We're all just kind of doing the same. We're all just kind of normal people. And so that's kind of where I feel like we need to tone the expectations down a little bit, and do some things like what you've talked about doing, maybe try to find some relationships that can withstand the isolation, but don't take away that heavy expectation.
And in terms of toning down, I feel like we should do that for all of our teens. I have
Yes.
my daughter's older sister is in high school this year, and the pressure that is put on those kids, I just want to say you're going to be okay.
Right.
If you get a B, or if you don't do all the things, it's going to be okay. And I don't want to be fear mongering, but my daughter at this point is mild. She was moderate, and I was afraid she could become severe. And I think it was enough of a scare that you know, I carry anxiety that if I don't pay attention and I don't pace, that her baseline could be lowered permanently. And there are children and teens who are not seen. And part of the reason they're not seen is because I think the parents don't feel safe to talk about how sick their kids really are. And, for me, monitoring her activity is so much about safety and being in the present, but also making sure that she can live a full life. Because I also, I also do think that kids can grow through this, and
Mhm.
I wish the people who recovered were studied so that we could understand, the before and after as much as all the other studies. But yeah, just protecting our kids and not forcing them into doing things that then cause long-term damage.
Right. Yep. And I think that whole thing of, going back to that question a while back of, is this PEM or not? And the idea that people do recover, children that recover, and this idea that, the sooner they're identified and not pushed, and their nervous system can, the metabolic system can have that rest time and recovery time, that's where the likelihood of recovery happens. It's not when you push. And that's where, I'm not saying I'm like the poster person for what happens to everybody. There's so many different, you know, heterogeneous types of stories in ME, but I was pushed and pushed and pushed, and then I learned to push and push and push because, that was what the, nobody ever mentioned that slowing down was possibly an idea. And, um, and
And
so,
that it's and that it's therapeutic.
right, exactly. And so, I truly believe, as high functioning as I am for as long as I've had it, and for the things that I know that I did to myself, I feel certain that if I had been treated appropriately as a child, I would be fine now, you know.
This is, I know we're coming up close to the hour, but I have an extra question for you. On the parent boards lately, I've been seeing chatter about neural retraining, and I just want to know what your thoughts are about neural retraining.
I think that if you go into it and you see it as like a program that helps you look at your entire stress load and you de-stress, then that's fine. But my personal experience with them is that it's another method where there is no way to prove that um, it works or it doesn't work. And when it doesn't work, what happens is it reflects back onto the person who's doing it, that either you didn't let go enough, you didn't believe enough, you didn't practice enough, you didn't use the right words enough. It all comes back to that. And there's so much of that in the ME world. That's where, I have personally no tolerance for that. But um, if
Uh,
you
You
can
know,
use it for just a general stress, then that's one thing.
yeah, I think it might be able to be supportive in certain context, but my biggest concern is that I see its capacity to be weaponized against people who are already suffering because, like you
Exactly.
said, they're accused of not trying hard enough, not doing it right. And in reality, if it was if whatever it is, if it was the thing that cured everyone, we would all go out and do it, right?
Exactly. Right.
Um, what are some things that are getting you through this next week and giving you hope?
Well, this next week I am very excited because my dear friend who I know because of ME, um, she is a medically retired PT who had a cervical fusion 5 years ago, and she is graduating from her doctorate in PT. And I'm so proud of her, and I'm celebrating with her this week. And then I guess just looking forward to holiday lights and type of stuff.
Well, thank you so much for coming on today. Thank you for all the ways that you have supported our family, for all the advocacy that you do. I'm just so very appreciative, and thank you, listeners today for coming on and listening. And if you are interested in ever sharing your story or would like to ask a question, please feel free to email me at joytaxpodcast